Hello everyone, I am Dr. Vikas Sharma. I am a skin specialist and hair transplant surgeon at Derma One Clinic. Today in this video we will be talking about scabies. We will discuss what is scabies mite, how does it affect human body, and how can you treat the aging caused by scabies. Scabies is a very common skin infestation. It is very easily treatable with simple medicines. So today we will be discussing in detail about scabies. Let us first try to understand what is scabies. Scabies is a skin infestation caused by a mite which is known as Sarcoptes scabi. This mite, it spreads from one person to the other by close physical contact. It can also spread by shared physical items. If you're sharing your bed with somebody or if you're sharing clothes with somebody, then also it can spread from one person to the other. Scabies is an extremely itchy condition, but it can be easily recognized by your skin doctor because of its unique features. So it commonly presents with only three types of lesions, which is small raised bumps which are known as papules. They are extremely itchy. They are present on your arms, hands, underarms, sides of your abdomen, and they are also present on your genitals. They are also present on your thighs and legs. Other than these, there can be burrows which are commonly seen in the space between your fingers. They are also seen on your genitals sometimes. These are linear thread-like elevated bumps on your skin. Then there can be excoriation marks. What that means is there can be scratches on your skin because of extensive itching that is there. Now, this disease typically tends to spare the face and the head in adults. It also spares your palms and soles. But in children, in very small children, it can also affect the palms and soles. It can also affect the face. Also, you may notice that your family members may also develop this infection because this infection spreads very easily between family members. Now we come to the treatment. Before discussing about the specific treatments and medicines, let us first try to understand what are the general measures that you can take to reduce the spread and to treat this problem effectively. So the most important thing is that your bedding and your other clothes, all these items should be separate from your other family members. Otherwise it can spread very easily from one person to the other. Also, when you are being prescribed medicines, you should also wash your clothes in hot water and preferably dry them in sunlight or iron them with a hot press. Also, it is to be remembered that all affected family members should be treated at the same time. If you don't treat your family members at the same time, then there may be a chance that if you get yourself treated, then the untreated family members may transmit the infection again to you. So, to avoid this, they should be treated at the same time as you. Now we come to the specific treatment. For specific treatment, mainly there are two medicines that are used. One is permethrin, that is to be applied below neck. It is to be applied overnight. You are supposed to apply it from neck till your toes and then leave it overnight and then wash it next day in the morning like you take a normal bath. Then a repeat application is usually advised. You are asked to do the same thing again once after 1 week. As I said already, that your family members should also be preferably treated on the same day of the week. In children, you may have to apply the medicine on your face and palms and soles also if your doctor advises. In that case, you have to be careful that the medicine should not enter the mouth of the child. Then coming to other medicine options, like there is another lotion known as clotameton which is preferred in children, but nowadays permethrin is the commonest medicine that is used. In some people, there may be chances that permethrin by itself may not be enough. For example, if there are a lot of genital lesions, in that situation ivermectin may also be prescribed. Also, if there is permethrin resistance, in that situation also ivermectin is used. It is a tablet that needs to be given according to the weight of the patient. So what we usually do is that ivermectin is given once at the beginning of the treatment and once after around 14 to 15 days after the treatment has been started. Now, all these medicines that I have described, they can have certain side effects. So it is always advisable that you get your skin condition diagnosed by your dermatologist. You should be sure that it is scabies and then use the treatment as prescribed by your doctor. Now, in this video, I have tried to tell you everything about scabies and its treatment. If you still have any questions, you can ask me in the comment section.